Good afternoon. I hope people will gradually connect. We see the number of participants, they're still joining, but I think we could start. This is the last day of our meeting. For 5 days, we were discussing issues related to the SNA update. Now we have a little bit different session, which is again looking forward, but it's more devoted to different solutions that countries have developed during the pandemic and methods that help them and approaches to produce statistics. And again, the aim of this session is to look forward and see how we could build on the work done and how this could be used in the future. I pass the floor now to Gerard Teddy, the chair of the meeting.
Thank you very much, Tekomira, and welcome everybody. Welcome to the 6th and final day of the Expert Group on National Accounts, the 20th one. Like Tekomira said, the last 5 days we spent on the update process of the SNA and the BPM, where we tackled various topics like communication, globalization, digitalization, and of course, well-being and sustainability. And for today's session, we have a bit of a different angle. Today, we will look at the post-COVID in the post-COVID situation, looking forward, and what you see or what you saw over the past year did not only change our society, but also changed our economies and the way we record our economies in the national accounts and the balance of payments, for example. And that's why we choose to have this afternoon session, well, specifically with focus on that. And for this afternoon, Tony Labillois, Director of Public Sector Statistics Division of Statistics Canada, will be our chair, and Eric Strassner, who is Associate Director at the U.S. Bureau of Economic Analysis, will be the moderator for this session. And I think this afternoon we will have a very interesting session, which will also focus on the questions we all have is, okay, how will COVID, and especially the period after COVID-19, change the way we record the economy, and perhaps what new data sources will become available, what new methods do we have to use. So I think it will be a very interesting session this afternoon. And with that, and no further ado, I give the floor to Tony. Tony, the floor is yours.
Hello, everyone. Can you hear me?
Yeah, we can hear you, Tony.
Excellent. Okay. So good morning, good afternoon, or even good evening to all of you. I'm very thrilled to be here for this last session with you. I'm honored. I want to mention that Etienne Saint-Pierre wants to say hi to everyone and send his best regards. I'm thrilled to do that with my colleague Eric. And I have prepared a few things for the introduction. So I'll close my camera because I need to look at my screen very closely. And I'll reopen it in a few minutes. So I've seen that the system of economic statistics was already evolving very rapidly before the pandemic to respond to more complex user needs in regards to globalization, digitalization, or economic measures of well-being. These needs are very well reflected already in the SNA research agenda developed by the ISWINA and well documented from global user consultations and very well articulated already in the previous sessions that we saw. We're now at that last session of the 20th meeting, and we've seen that in the last few months, this was nothing in comparison with what we have experimented over the last year and a half. The COVID-19 prevalent in our lives and affected all of us in our role as data compilers too. So we really had to navigate through a completely uncharted territory, full of challenges and opportunities. With the COVID-19 pandemic, the compilers of statistics have proven that they can innovate, they can adapt quickly and provide data in near real time. This agenda item today will discuss many of these innovative solutions that were found and that could be translated in the post-COVID era. And we'll discuss how the lessons learned from the past 15 months could be used to advance in a permanent fashion the responsiveness of data compilers to user needs of national accounts statistics. And we'll also discuss how we can keep that momentum and not snapping back to the traditional pre-COVID landscape. In fact, it's really amazing all the things that have been innovated. And we have 5 papers today in the session that are touching a wide spectrum of topics, illustrating that kind of momentum that we gain. A lot of efforts were to deal with the requirements for timeliness, high frequency, and granular data. Those were 3 absolutely essential key elements for users and policymakers during the pandemic. The quarterly and even monthly updates were far from being timely enough for our policymakers. The first 2 papers presented and the last one will show 3 great examples where the combination of high frequency data and modeling can provide valuable early economic signals. The BEA will present a paper showing new timely estimates for spending using card transaction data. Statistics Finland will introduce their new, faster non-market LKR output indicators, which had to be developed in 2020 for the quarterly national accounts compilation due to the significant structural changes into the activity of public healthcare sector during the COVID-19 pandemic. A real example directly related to what we were all facing. A new output indicator was developed using both existing and new data from the Finnish Institute for Health and Welfare. In the last presentation of this session, IMF will present their work with Google Trends and Google Maps to try and help countries enhance the frequency and timeliness of GDP estimates, as well as to develop business operational indicators. IMF Statistics Department has been undertaking research to determine how data from the Google Maps and Google Trends platform can be accessed and processed to align with official international statistics economic concepts, classifications, definitions, and compilation methods, and how these data in turn can be used to increase the periodicity and timeliness of official measure of economic activity. The 2 papers presented just after the break by Statistics Canada and then by the BIS and South African Reserve Bank clearly highlights the collaboration between the different actors of the statistical system as being instrumental in the post-pandemic world to address fast evolving data needs. The statistical framework and the infrastructure should be designed to be conducive to leverage the increasing mass of information available as a substitute or complement to our existing statistical programs. Collaboration data sharing exchanges of national experiences, co-development could contribute to avoid duplication of efforts and fast-track the modernization of our statistical framework and infrastructure in the post-COVID era and produce more timely, more frequent, and more granular data. This is very important. You will see that I hope in the discussions we get there so that we have a chance to see how we can collaborate further beyond what we've been very successful at collaborating already. I would like to express my sincere thanks to the authors and the contributors for today's papers, and I wish all of you a very good session. Eric and I are looking forward to the fruitful discussions, and I want to remind the presenters to keep in time allocated to speak. And so we have 15 minutes allocated for presentations. And please don't speak too fast to ensure smooth interpretation. All participants can write their comments and questions in the chat. Eric will monitor the chat, and he will summarize the comments and questions received. If the time is there, hopefully we have enough time for discussion, and we can give the floor to some delegates. If you wish to speak, you can raise your hand by clicking the Raise My Hand button. So we're now ready for Kyle's presentation. Kyle Hood is an economist at the BEA. And Kyle, you can go ahead if you're ready to share and present.
Yeah, can you hear me?
Yes.
Okay, thank you, Tony, and thanks to the organizers for having me here to present this talk. I have a lot to get through, so I'm just going to get started. Today, I'm going to cover two projects. In the first project, we use card to measure spending during the pandemic. This is joint work with Abe Dunn, Andrea Batch, and Alex Dreesen at BEA. In the second, we looked at more traditional nowcasting techniques to get estimates of private consumption of services, and this is joint work with Bao-Lin Chen. So I'm going to talk about these two projects in order, and then I have a slide at the end to kind of tie them together a bit. So just in terms of motivating, when the pandemic was declared, we started seeing social distancing, shutdown orders, and we knew at BEA that there was a need for members of the statistical system to respond because of two things, really. Things were happening quickly, and at the time there was some concern also about the quality or reliability of our standard indicators. To respond to this need, we using data derived from card transactions. These are very timely with a 3 to 5 day delay. They're high frequency, a daily frequency, and they exhibit a relatively fine level of granularity, 3-digit NAICS, as mapped from merchant categories from the card companies. So I'm going to move to an overview of how I present this talk. I'll start by talking about the data source. I'll touch on the model, and then an overview of the daily estimates. I'm then going to move to a discussion of lessons. We look at a comparison of the card data and source data we normally use, and we're going to look at that before and after the pandemic. So we're going to show here that the card data were more informative than some of our pre-pandemic evidence would have suggested. So just onto the data and methods. This is going to be a very broad. The card transaction data come from Fiserv, which is a leading card transaction intermediary that does about $2.6 trillion in card transactions annually. Each of the observations is a card swipe, like a debit, credit, or gift card, or an online transaction. But we're only going to see aggregate data at the national level by 3-digit NAICS. We have a paper that discusses these data, but I'd like to note that the original methodology for constructing them, Federal Reserve Board and Palantir, and it's in this paper listed here. The key aspects of this are that it's the 13-month rolling panel methodology, so firms are included in the panel only if they are there for 13 months. And it's sort of like a chained constant firm index, and then benchmarking to the 2012 economic census to sort of get the levels right. I'll note some to the data. They're not necessarily representative because they weren't survey or census constructed. There is variable coverage across the different categories that we have, and it's unclear if a firm enters or exits why they're doing so. Very briefly on the method, we use a regression for log levels for each of these categories on some indicator variables to eliminate seasonality, term trends. It's hard to do seasonal adjustment on daily data, and so we decided for simplicity just to do it this way. There will be a little bit of seasonality during the residual seasonality, maybe during the pandemic period. We only use data as well from 2017 forward to estimate the model as sort of a compromise between estimation error and misspecification. This is a picture of the data. It's a direct comparison of the growth rates of Census's aggregate monthly retail trade in orange and the Fiserv data averaged over the month. Neither of these is seasonally adjusted. So you can see here that despite them being from highly different sources of information, the aggregate series are very close over the pre-pandemic period. I'll note that in growth rates, the industry-specific correlations are, however, not nearly as high, but the correlations in levels are much higher, again, for the detailed industries. Okay, so now on to some results basically what I'm going to show you here is a sequence of 7 slides with on the top panel being the daily and the bottom panel being weekly numbers. The horizontal axis of dates, they're not exactly lined up, but the red vertical bar will show the pandemic declaration date. The vertical axes show percent difference from the expected the expected level after the pandemic. So we can think of that as sort of the cumulative change since right before the pandemic. So on to food and beverage. Here we see a spike right after the pandemic as people stocked up on toilet paper, water, etc., followed by a drop and then leveled off around 10 to 20% above the pre-pandemic spending level. For gas stations, we saw a large drop in spending right after the pandemic to about half of pre-pandemic levels. About half of this was due to price changes and half to quantity changes about. Then up July, maybe into August, we saw a recovery to about 20% to below pre-pandemic levels, and then in the most recent periods, more of a recovery. On clothing, note the scale. This is actually a very large drop of about 75% below pre-pandemic levels. Again, followed by a recovery through July to perhaps just below pre-pandemic, and then maybe a recovery in the very recent period. Ambulatory healthcare, this is doctor's visits. So here we saw a drop right after the pandemic to less than half of pre-pandemic levels. Again, followed by a recovery into the summer through July to August to approximately pre-pandemic levels. Next is accommodation. This was the hardest hit category. Anticipating the pandemic, we start in accommodation spending down to less than 80% below pre-pandemic levels. Again, a recovery until about July, August, but we hover around 50% below pre-pandemic levels with a little bit of an uptick as things have opened up a bit. Restaurants were nearly as hard hit as accommodation, to drop of 70% below pre-pandemic levels, with a recovery again through July, August, and sort of a constant level after that, with maybe a slight uptick during the recent opening up of the economy. So overall, we have aggregate. There's a combination of these effects. You see the uptick from stocking up, and then the drop in spending after the pandemic was after this uptick, followed by a recovery through about July, and then things remain constant. Of course, there's a distribution. People are spending more on groceries and general goods and less on accommodations and restaurants. Okay, so now briefly I'll discuss our timeline in developing these estimates. So after the initial pandemic declaration, we were able to release a working paper with initial results within just over a month in April. Around this time, the data were also used to certain estimates that, in production. Then in the June of 2020, we began releasing bi-weekly and then weekly regular updates of our card data numbers. And it was really familiarity with the data sources that aided our efforts. We had been working with these data for several years on various projects, and so we were able to anticipate which of the Fiserv categories would do really well, and knew how the data could be used. Nevertheless, even though we've worked with the data, what we knew before the pandemic actually showed the Fiserv data in a worse light than what we learned during the pandemic. So this graph here shows in blue the correlations between these various categories of services with the quarterly survey, which is our standard indicator in terms of growth rates. So most of these blue lines, blue bars show very small correlations, and sometimes they were even negative. The orange lines show correlations around the pandemic and after. Admittedly, it's not based on very long time series, but yeah. Anyway, the difference is stark. We can see much larger correlations during this period, despite small ones in the pre-period. This figure here shows the same analysis for monthly retail trade categories. So while the change isn't quite as stark, we still see increases across all the categories in how correlated the Fiserv is with MRTS. So here we think that the relationship has changed. So just to summarize what we saw before the pandemic period, the Fiserv data showed these very high correlations in levels, but low correlations in growth rates. And so we kind of thought, well, maybe the correlations in levels are what are informative during this more volatile pandemic period. And then after the pandemic, the correlations in growth rates ended up being higher. So we think that this is about the statistical relationship changing and the volatility of the economic signal changing relative to the idiosyncratic factors, which became much more dominant during the more volatile pandemic period, or the economic signal became more dominant during the more volatile period. Okay, now quick break. I'm going to go on to the second project, so just 2 seconds to breathe. Okay, so briefly, GDP and its components are estimated 3 times at BEA for each quarter, with a 1 month, 2 month, and 3 month lag. What we're going to do here, the problem is that at each of these estimates, different availability can yield large revisions in components of GDP. So this project, we're considering nowcasting these detailed components, employing traditional techniques and model averaging. And our results are going to show that these nowcasts can improve forecasts and reduce revisions. Model averaging can improve forecasts, and that nowcasting and reduce revisions. So the general motivation is that PCE services is quite large. It makes up about half of GDP. And we don't have source data for the first estimate for most components. So some of the stand-in indicators are just not highly correlated with the QSS series. Maybe over the long run, they track similarly, but not on a quarterly basis. Just to give you a general idea of the timeline, the orange ones are kind of middle of month, and the blue ones are end of month. So we have the end of the reference quarter, the first advance estimate, the second estimate, the third estimate. So we have no QSS for the first estimate, limited for the second, and then full QSS for the third. So we're going to target this third estimate for our nowcasting prediction, but we're going to look to get the improved estimate here of any QSS data. Just a very brief overview of the approach. Without going into any details, we're going to look for long-term. We're going to look at using information on long-term trends, medium-term behavior, and cross-sectional behavior our indicators. We note that there's a very short time series here. We have quarterly data only since 2009. So while we use nowcasting approaches, we're going to consider a bunch of different techniques, including model averaging techniques. We still have to split the sample and estimate and validate the approach. But instead of looking at each individual series, we're going to look for general trends across the indicators. And the measure that we're going to consider is the root mean squared revision. So this is a summary of the results from exercise. We have 7 different categories that we looked at with 88 components, where the first estimate used a different series than the third estimate. This third column here is ones where our method did not reduce root mean squared revision in the validation sample. That's about 9%. I realize I'm over, but I'm very close to being done.
Yeah, that's okay.
The fourth column is the number where a linear model, which used the same indicator, but used some medium and long-term information, was the best model. That was about 10%. This fifth column are models which use cross-sectional information. They were factor models. So that won in about 9%. And then these model averaging methods won 72% of the time. Averaged stuff from the models that used the indicator and the factors. And you can see here from this last column that the range in revisions can be quite, in some of them, the revision reduction was only 1.5% of the original revision, but in many cases, the revision reduction could be much larger, slashing half or even almost 2/3 off of the average revision in a root mean squared sense. Okay, so the last slide. So BEA is exploring several ways to improve the timeliness and frequency and also precision of our estimates. We've seen that an alternative data source can offer a high frequency, timely estimation that performed well during the pandemic. So nowcasting techniques have also shown potential. And I didn't show you this, but they did not perform for many of the series over the pandemic. So our next steps are really about exploring additional new data sources and seeing how we can incorporate those into our estimation methodologies, and also to incorporate new data such as the Fiserv data into alternative methods, such as nowcasting and forecasting methods. And I will say that the pandemic really has provided an excellent test to see how well different models and data sources would have performed over a relatively volatile period. Thank you.
I saw that in there a lot of importance of the knowledge of the context and the knowledge of the data to make sure that the forecasts were good, and also a very important aspect to get the data in a matter of days to forecast big shifts. So I think that's a good start for the session. I encourage people to use the chat function to send comments and questions already to Eric and to all of us. And thank you, Kyle, once again. And now I will invite Billy Lindros from Statistics Finland to make the presentation.
Thank you. Good afternoon, evening, and morning, everybody, from rainy Helsinki, Finland. And I'm going to discuss now the non-market healthcare output indicators that we have developed for the monthly and quarterly level. First, we're going to look at the significance of non-market healthcare, especially in Finland and in Nordic countries. And second is going to be about how did COVID change the situation. And last part is about the new solution, the new indicators that we came up with. So yeah, I think in the Nordic society, the non-market producers for healthcare and education is very important, and the proportion of the non-market healthcare to the GDP is 4.4% in Finland. And why I present the output to GDP ratio is if we extrapolate the volume with an indicator, it's going to all go directly to the GDP. And if we look at the supply and use tables, we have 3 important products in the healthcare. We have the hospital services or the special healthcare. We have the basic healthcare, the medical practice visit or the services, and the dental still noticeable with the 4%. And we have in the annual national accounts compilation, we have the volume indicator, output indicator for all 3 of them separately, according to the European System of Accounts and the Handbook of Volume and Price Measures. We have this kind of measures behind the indicators. We have hospital services that are about the diagnosis resource group weighted episode output. This has a high level of stratification in the data, which means that we catch a lot of that quality component and not just quantity. And this is originally a productivity statistic, so it's a really suitable one for measuring the output. For medical practice services, we're looking at the visits by service and profession. So we have different services like the prenatal services and your basic healthcare center visits and school nurse and so on. And we have the weights according to that and the different professions providing the services. There is still some inpatient care also in the medical practice services. So we have the periods of care by the resource utilization groups, giving some weight information in it. That is quite marginal nowadays, as these services are more on the social side or possibly in the hospital, depending what kind of service it is. And then in the dental practice services, we're looking at the visits. Once again, it's basically identical to the medical practice services by service and profession, but of course there's a little bit less different kind of services and professions in the dental side. So this is kind of our annual one that we would want the quarterly one to be also like, but instead our quarterly method has been a value indicator that is based on the wage and salary sum. So more about the input, and it's been also deflated with the index of wage and salary earnings. So once again, input related indicator there. So we're in the world of deflating the inputs, basically. We do not look at the output directly. The quarterly national accounts have forecasted historically quite poorly the annual change. So here we have the 2010 is benchmarked here, and the rest is broken down to the original high frequency series, and this is sometimes been hitting somewhat decently, but other times, as we can see towards 2017, it's really poor the power to predict anything about the annual change. 2019 happens to be a really good one, but seems to be more random. And my interpretation here is that if we think about the public sector and what is their goal even in the healthcare, it's mainly to still like answer the demand. They don't necessarily want to create output more. They want to just keep up the output and possibly increase the productivity by cost efficiency. So then the lowering of inputs with this kind of indicator always would end up in a lower output and have the actually reverse interpretation of the actual productivity. So this is what I suspect that is happening when we use input indicator for output. Then came COVID-19 last year, and we already knew that our indicator is weak, so all the more reason to start to look into it. We have all kinds of laws and regulation that I haven't seen in my lifetime, and non-critical care was, for example, cut down a lot, and a lot of the resources were directed toward the intensive care instead. I've listed a little bit of some phenomena here that I could come up with that are either direct or indirect related to the healthcare during the COVID time. And there is, for example, these directly COVID-related testing, treatment, vaccination. I put the unit cost column here to say that kind of we didn't have it previously, so it's going to have to increase the cost. But it's also real output, so it's real volume as well. Then we have to cut down on the services, so I can only imagine that that is lower volume. We had changes in processes, which in the traditional way of having a clinic appointment and so on would mean maybe having the masks and hand sanitizers and more distance between the patients. But on the other hand, we had also the kind of thing that we started to have more and more of these remote appointments and video appointments and phone calls and chat that started to replace the traditional ones. And this is why I'm not going to start to guess at what kind of effect it had, as it might have been on initial cost, but possibly towards the end of the year when the adaptation was done, we had increased volume thanks to the new ways of doing things. And of course, the whole epidemic and the government rules have changed people's behavior as well. And hard to say what kind of effect it might have had in the healthcare output. The weakness of the current method is that it obviously cannot really count any of these direct or indirect effects if it doesn't show in the employee compensation. So if it has nothing to do with the labor input, then it doesn't really show. And even when the non-critical care was cut down, it didn't mean that people were necessarily fired and laid off. They were maybe more on reserve or going more towards that capacity in the intensive care, but they didn't necessarily produce any output, which means that our levels would stay quite steady when we look at just the wages and salary. Even if we would look at the hours, they might stay quite steady, and that would not be the realistic figures that we would expect to have for the annual proper indicator. And of course, we would expect to have a quite significant revision when finally the annual national accounts would be published. Ideally, we would want that the quarterly volume is of course realistic and accurately forecasting the future annual change, if we think about the annual point of view there, but also at the same time it should quickly give us the updated image of the economy for each quarter that we're looking at. And even if our annual levels are fine, we would also want to see that how is it seasonally going through the year in different quarters and months even. And of course want to be able to compare in time and especially between geographical areas like the European Union member states. And what kind of indicator would possibly suit as well here would be, of course, something that is quick. We would like to have it for the even for the monthly trend indicator of output already, and from there it would trickle down to the quarterly national account for the previous quarter and not later than that. Of course, it still should be relevant as well, looking at the correct indicator that correlates with the healthcare output. It should be rather simple than complicated. Complicated usually means that we set our goal a little bit higher, but maybe our rate of hitting that goal is a little bit worse if the model would be complicated. So we rather go with a simple one. We were looking at the solution that is not COVID specific, so long-lasting solution over anything temporary. Ideally, it would require only one person to lower the kind of risk in the person being able to do it. So human risk kind of lowered if only one person can do it, and we have proper instructions that it can be easily moved from one person to another. And of course, having an automated process helps in all of these at the same time. Then before building up a new indicator, having a look a little bit about the Eurostat reminder about these non-market output indicators, we should not apply any explicit quality adjustment. This applies mainly maybe to the remote school world during the COVID time, but it applies always to everything. It's not COVID specific. Quality changes can, of course, always come to stratification. And then there was the reminder that the unused capacity does not contribute to the volume of output. And we had a lot of facilities, personal machinery, especially in Finland, that were not producing any output actually. And this is something that when communicating to the users is very important to point out that, hey, just because we had money and people in that, it didn't actually produce anything. Then to the new solutions, we started to first look at the medical practice services, even though it's a smaller part actually from the healthcare, but it's easily available, the data. It's actually the same indicator as for the annual level, but it just has less detail in it. And it's actually available even weekly, but we find it safe to use at the monthly level. So it comes to the trend indicator of output at monthly level. And then finally, we use the same data for the quarterly as well. And I cut out the end of it because this is what we needed, what we could see when we decided that are we going to use it or not. So one nice thing about it is also that we could see that there is some sort of trends going on there, that the first 5 months is always high in the year and summer is always lower, December is always lower, and this repeats. Only have 2 years here now, but it kept on repeating over the years. And we could see that now the pattern was broken in the beginning of 2020 there. April was very low month, as well as May, and actually going up towards the summer, which made us think that this is at least telling us something that the salary is not. So this was the reason why this was then our first healthcare indicator, that it was coming 100% from the medical practice side, which is of course not ideal, but this is what we had, and it comes from the visits. But then that was basically that we had when it was the compilation of the second quarter of 2020. Then for the third quarter of 2020, we got the new data from the Institute of Health and Welfare, which was related to the hospital services. It was like a preliminary data of the hospitals. And it had the inpatient treatment periods and the outpatient visits. And what we saw is that the pattern was very similar in the hospital side as well. We had only 1 year here, or I mean, we had 2 years basically, 19 and 20. So it's a little bit more uncertain, but nevertheless, the 19 showed very similar than the medical practice visits. And the pattern in the 2020 looked also similar in the beginning, which was nice to know because we made our decision to use this indicator, and it turned out that it wasn't completely rubbish compared to the hospital data at least. But it was also very crucial to get this data because, as we can see, there is quite a divergence toward the end of the year. The progression is completely different in the hospitals than the medical practice side. So this was important to get it because hospitals ended up being still having a bigger weight. So now we had then 3 quarters coming from the hospital service, like it's kind of supposed to, their original weight, and then 1 quarter coming from the medical practice services. So basically dental is going with the same as the medical practice. Unfortunately for the inpatient treatment and the outpatients, we don't have any weights yet on it, so we're just looking at the average of the change. But maybe we can improve that in the future. Here's how the volume index was looking like. January 19 has been put for 100 here. Like we saw from the forecast graph, it's sloping weirdly down towards like 18 and then steadying with the old method. And then January 2020, we take the new method, and we can start to see that now we're going to be following more the seasonality of these other indicators. Of course, as 2019 is not yet following these indicators, the levels are not going to be perfectly here in between, but the changes are the important ones. So the changes are corresponding what they are supposed to be. Then if we'll look at what happens to the deflator. When we look at the old method, the input method, it's naturally quite steady, 2 to 5% always. But if we look at the implied deflator with output method, we can see that we are having some real changes here and actually having over 20% increase in the implied prices for the second quarter of 2020. So this is the story to kind of tell that the volume fell and prices went up and value stayed more steady. Okay, look at how is the forecast for 2020. It's -8%, and now I would like to tell you that did we hit it well or not, as we're already in May. But unfortunately, the data has been delayed a couple of times now, and I'm not able to tell you yet. We do not have it yet. I have just a couple more slides anymore. Some advantages of the new indicator. It's very similar to the annual one. It's frequently updated. It has open data concept. We don't have any specific deal. Anybody can just take it from the interface with any programming language. can be automated. It's very simple. I haven't spelled out any formula here, but you can see from the kind of process flow that it's simple. It can be a long-term solution if our source keeps on providing this. And it has low human risk factor, like we hope for. With simple instructions, we can move the process from one person to another if we need to. Some challenges. As you saw, the hospital data also only start from 2019. It's difficult to test backwards. Would be nice to see that how it would have done in the normal times, basically. Also, the annual data source is now delayed for now, which means that we do not know. We had to do the first quarter of 2021 already without knowing that did it actually perform well or not. The next step is that hopefully we still get, well, a couple of days left in May. If we would get the data, either way, then for this summer, for the annual national account, we'll either get it from over the counter or under the counter, the data, and we will have our annual indicator. We will see how well the new monthly and quarterly ones perform and decide whether we continue using it or not. And like I said, we're missing some weight information when we look at the hospital data, and our idea is that we could use the 2020 DRG base, having the diagnosis resource groups there, to have more weight information and possibly the third version of the indicator. Thank you.
Thank you very much, Ville, for another very interesting presentation. I realized there that there's a number. I want to encourage people to use the chat, actually, before I say anything else. Please use the chat to send your questions and comments as Eric is looking at that and compiling them. I realized that in this presentation there is a lot of usefulness to keep producing useful indicators to be able to adapt quickly and to find fast, simple, reliable, automated, relevant processes. And the use of open data also drew my attention there. And I think that's very important. I look forward to the discussion. So without further ado, I'll pass the floor to Eric to summarize the comments.
Okay, great. Tony, thank you very much. Let me first begin by complimenting Kyle and Ville on their very informative and what I thought quite excellent presentations overall. And so let me just comment on them briefly while we begin to see wants to come in to take the floor. I see Sanjeev has signaled that. We also have a few comments. I definitely look forward to hearing delegates' comments on Ville's presentation as well. So just a couple comments from me to kick us off, just to get things started. So really nice examples of using novel data sets to inform estimation during the pandemic, certainly economic measurement innovations. And these are the types of things we want to bring forward out of the COVID environment, which of course is what this session is all about today, thinking about our lessons learned and what we take forward. And so we heard about payment card data, we heard about volume data, and indeed we know that many stats agencies have made much greater use, expanded use of this during the pandemic period. So thank you for these presentations. There's a couple comments that are complementary of Kyle's presentation so far, so I'm just gonna summarize them. They come from Catherine at the World Bank and Jens from Germany. And so Catherine's comment is about how this demonstrates the potential of using transaction data to improve timeliness and quality. There's also at times concerns about procuring these data sets, sensitivity from a privacy perspective. And so the question here for Kyle is, did BEA encounter any challenges in securing access and in the dissemination of these outputs from a privacy perspective? And then Jens wants to know if this was something that, did we have to pay for this, or were we able to get access to this data more freely? And so I'm going to ask Kyle to think about those, while I also right now ask Sanjeev to take the floor with his question. And then as Sanjeev is coming in, I want to encourage everyone to offer their comments or acknowledge they want to take the floor. So Sanjeev, when you're ready.
Can I just check? Can you hear me, Eric?
Yes, I can. Clear.
So firstly, thank you very much for letting me take the floor. I think the two excellent and very different presentations from Carl and Villa, much appreciated. A couple of comments and then a couple of questions. First comment, I think the statistical community per se around the world has obviously had a massive challenge in measurement. And I think it's responded very well, and we should actually take stock of that. Our ability to quickly think outside the box, use other indicators, etc., I think is commendable. I think it's definitely worth experiences and knowledge to share. More specifically, my next layer of comments will be, obviously indicators have a role to play. They really have got the timeliness feature about it. Maybe not the comprehensiveness, but more importantly, they're not a national accounts product and they're not on a national accounts basis. So as we compile the maturing national accounts data sets to the quarterly national accounts and then benchmarking, my question would be, for both presenters, have you got plans on how you will assess the predictability? And obviously, if the indicators are very good, that's great. Second theme I would want to throw in is seasonal adjustment. Obviously, that's a big challenge. How are you expecting to handle, as the year completes, seasonal adjustment? Because obviously this is real, this is taking place. We don't want to seasonally adjust out some of the severity of the impact that's taking place. So what are your plans there? Also, there's substitution effects that the indicators may not pick up. Have you made adjustments for those? So, for example, people weren't going to the shops, but they were spending money on food delivered to their house online, etc. And so likewise, recreation, they weren't going to the cinema, but watching Netflix, etc. So, have you adjusted for any substitution effects? On the non-market output presentation, obviously that deflation of non-market is always very difficult. Can I just clarify, did you change the weights in year, or are you using like base year or chain linked weights? Because obviously as we go through 2019 into 2020 and then into 2021, the weights alone will have significant effects. And when we change the weights, it's going to be very important to assess the impact. And my final point is a comment I just want to put in a plug to piggyback on the statistical community, that in the UK, likewise, we've reacted with, I think, 3 fundamental areas. New survey with lots of questions for businesses, etc. We've gone down that channel for sure. Obviously, we've collated lots of faster indicators to help us to have the information to make sure the normal work we're trying to do in measurement is okay. And then the final thing is, as many of you may be aware, we have the Economic Statistics Centre of Excellence that's doing quite a lot of work in the COVID world on faster indicators. Think areas like regional impacts, jobs, vacancies, etc. So that's a bit of a plug for the ESCO and the UK effort as well. But otherwise, thank you very much for letting me take the floor. Back to you, Eric.
Sanjeev, well, thank you very much for offering your intervention. There's been a couple more things that have come in through the chat that I'd like to acknowledge. So Peter from Hungary, he asked Kyle about the card transaction data and its coverage and representativeness. So Kyle, when we get to you, I'd like to have you speak to what we know about that Fiserv data and its representativeness and how we've made use of it. And then Marshall has also come in, and he asks, how do the Fiserv card data handle merchant births and deaths? Does Fiserv simply drop merchants that weren't present at the beginning and end of the panel? If so, any ideas what biases this causes? This is useful for us. I'm going to put forward just a couple thoughts here as well, and then we'll turn to Kyle and Ville for this first round. We'll then see if any more comments come through the chat. So for Kyle, you preview at the end the connection between the payment card transaction data to innovate during the pandemic with the nowcasting project predated the pandemic period. And so tying these things together, can you speak a bit to where we're headed at BEA, making use of that payment card data along re-emerging on the nowcasting techniques that we abandoned because of the sudden and rapid changes during the pandemic? for Ville, of course, really interesting presentation about input costs, about how those are challenging to continue in the pandemic, to look at volume indicators to account for rapid changes. Can you talk a bit about the post-pandemic perspective, how you'll be communicating some of these changes if you bring them forward out of this period, and how you've perhaps innovated in some other areas in your work around quarterly national accounts? Okay, so let me pause us there. And Kyle, I know that you got your connection disrupted at one point. I want to check to see if you're back in now, and if we can have you take the floor to respond to some of these interventions. Okay, it looks like we might have some challenges with Kyle at the moment. Ville, can to take the floor and respond to some of these interventions, and then we'll return to Kyle after that.
Yes. Thank you for the questions and comments. I think looking at a couple of these questions, I think one thing that comes to my mind is now with the new world, new solutions, that what we are doing much more than ever before is we're doing kind of expert adjustment and expert decision on things. This applies, for example, to the weights that Sanjeev was talking about. We just have to acknowledge that it's going to be different this year, but we don't exactly know how. We will have to do assumptions, and we have to see how well we hit it and update when we get more information. So this is not just in non-market. We think about hotels, restaurant. We have to do the same kind of assumptions here. We simply, I mean, we know that things are different. We don't know exactly how they are different. So we kind of did the decision. This applies also to the quarterly national account in general. I think that even in the monthly volume statistics, that we will take like strong expert stand here on things instead of letting go with assumptions that we would know that are faulty. So we take a bit of risk and we do our own decisions. Oh, maybe travel is another one. We know that the freight has gone up a lot in the ratios instead of the passengers. So we have come up with our own adjustment for it, and it will be what it is. And probably the methods do not shouldn't be brought to daylight too much. Let's see how it goes. Seasonal adjustment. I'm thinking about the fact that we didn't actually have any seasonality in it before, because we had the wages that are completely steady. And what we want to see now is that what is the true seasonal phenomenon in the healthcare. Actually, it's of course difficult to start from now this COVID year. It would have been nice to see what is the seasonal influenza, how does it show in and so on. Now we can only see that what we have is, okay, schools shut down for the summer, so we're going to have less school healthcare, but otherwise we cannot really see what is happening. So for now we're kind of observing that what is happening there, and like you said, we want to see the true things happening there. And the communication, I think the toughest communication comes always from the main user, being pretty much the government and the finance ministry, and trying to communicate really clearly that what is price and what is volume. I think that is the difficulty here, as it's not really easy to understand for people who are not compiling the statistics. And I think we have some good cases to make. I think we have been discussing this whole idea that when you have one COVID patient, it increases the price of every other patient too. So we have this kind of marginal effect that we're trying to at least communicate. This is maybe one way of communicating it. I think quarterly national accounts always have challenges on how to communicate things when the statistical discrepancy can be huge still. I think that's what came to my mind now quickly. Don't know if I missed some question there, but you can tell me if I did.
Very helpful responses. Kyle, I'm going to turn to you, and I know that your connection was a bit disrupted, and so I'll try to help re-ask some things as needed. Okay?
Yeah, I think I don't know how much time we have. There were a lot of questions. but I can kind of go through them from the chat if that works.
We have time, Kyle.
And then kind of, yeah. Okay. So, so just on Catherine's question with regard to the privacy, so we don't actually process the microdata. Those are processed by Palantir, which is they're the only ones that see the microdata. There are concerns that they have with privacy vis-a-vis the the different firms and stuff, but they do process a lot of transactions. And so at the national 3-digit NAICS level, we're not going to see much suppression, but they will suppress some of the series. So at the state level, for some of the NAICS categories, we do see suppression. So from Jens from Germany, a question about the data being freely available. These data are purchased by BEA, and I'm not actually involved in the purchasing. I know that they aren't cheap, but that we had a budget to look into that prior to the pandemic, and we're using the data for a variety of different things, different projects. They ended up being quite useful during the pandemic. So Peter, I guess, from Hungary, had a question about the coverage high enough to be representative for total turnover. I'm not really sure that the coverage rate for these is quite, Fiserv does process a lot of transactions in the United States, but I think there are some cases where the coverage isn't great, or where the merchant categories aren't great. So we certainly excluded categories that we really didn't believe in from what we showed. We only showed about a little more than a dozen categories in our releases and in the paper. But yeah, I'm not really sure how to answer that. But maybe you could send me an email and give me some more details. And then Marshall asked about firm births and deaths. I did talk about this to some extent in the talk. This is basically a merchant sample, or it was designed as a constant merchant sample. So basically, if the merchant isn't in there for at least 13 months, they're not used at all, and only the within merchant growth rates are considered. So if there are merchant births and deaths, those will not generally be captured. And of course, that will create some biases if in the aggregate there are births and deaths due to some kind of event occurring. Now, I know that we had discussions with Fiserv to adjust the data during the pandemic period to take this into account. And what they ended up doing was taking the set of merchants that were that sample before the pandemic, or immediately before the pandemic, and holding that set of merchants constant. Of course, then we might have exits that we can capture, but there may be exits from the Fiserv system, so we may be overestimating the sort of drop in spending or underestimating the overall level of spending. I believe, and I'll have to confirm this, but I believe that we have stopped doing that at this point. So we're back to the constant merchant sample method. So I wanted to touch on the question of seasonal adjustment. I think there's a lot of research to be done on how to deal with seasonal adjustment for daily data. Even if you do like a year on year as sort of a quick and dirty statement, leap years kind of mess things up. And so it's really tough to know exactly what to do. We decided to use sort of a very simple indicator method and to use a very short window to try to capture some of it. But as you can see with our daily series, there's a lot of within week patterns that we weren't able to remove, despite the fact that we used day of week indicator. And then I did want to discuss a little bit about sort of what projects we're working on at BEA. So we are working with this group, Opportunity Insights, to get a hold of some of their series that they use to they have sort of an economic tracker, and we're looking at their method with them. And trying to see if there's a way that we can compare those data and find some use cases for them for us. And in addition, we're looking at methods we're looking at another data source that I can't really talk about, but it's not a card data source. But it's available again at high frequency and relatively disaggregated basis. And these projects are the goal in national accounts is to produce more timely national accounting series, typically not trying to nowcast or forecast on the big aggregates, but trying to get the detailed components of various GDP, and then we're also I know the regional group is also very interested in a lot of these data. With Fiserv data, for example, we can see we can see sort of within country, cross county consumption. We can see what county people live in, and then what county they're consuming in, and so that's research, and then consumption at the disaggregated level, and so we're comparing these methods. We're seeing what these data can do for us in that respect. And then Brent asks, did the pandemic affect the performance of the nowcasting methods? We don't. This isn't really in our. We haven't done a study of exactly how the pandemic affected the performance of the nowcasting methods, but I will say that the nowcasting methods did not perform particularly well during the pandemic relative to what we ended up doing. But we need to look at sort of how the nowcasting methods performed relative to what the indicators directly would have told us. That they may have performed better than the indicators, but there may have also been adjustments that were made to the data, so we didn't just use the indicators during the pandemic period. And it's really going to be really hard for a statistical method to beat sort of the art of making GDP in a careful manner. So that is response, and I think I'll just go leave it back to Eric.
Kyle, great. Thanks for the thorough set of responses. I'll just acknowledge that Craig McLaren of the UK has come in and said that they're looking at methods for seasonal adjustment of daily, weekly indicators as part of their efforts to improve. They're looking at the predictive power of monthly and quarterly indicators, and is happy to follow up separately to talk about all of this with both Vile and Kyle, which sounds great. And Marshall has come back in as an example of an impact of the treatment of births and deaths in card data. A paper on the impacts of hurricanes incorrectly concluded that Hurricane Harvey had a relatively small effect on Houston. because merchants that never excluded from the analysis. So helpful just to be thinking about how we treat births and deaths in this type of this type of measurement innovation. So thanks for that, Marshall. Tony, it's looking like we don't have anybody else coming in at this point. Could perhaps turn things now back to you. I do just want to on my side for now and thank once again Ville and Kyle for their thoughtful and comments to the delegates' interventions. Thank you. Back to you, Tony.
Thank you so much, Eric. And yes, I want to echo your comments about the excellent presentations from Kyle and Ville. And thank you and all our audience and Ville and Kyle as well again for the very interesting discussions we are having. I see some common themes emerging, and I'm not surprised. And now we have 15 minutes of coffee break before we come back for this last stretch of the sessions. You can stay connected. You can still send some things through the chat if you have some other thoughts, and we will welcome that. And then we will speak after the break a bit more about collaboration and some more examples of how the pandemic has made us so creative. Thank you. See you in 15 minutes.